Welcome to the NHA Phlebotomy Exam Study Guide, your path to NHA certification. Whether you're just starting your journey in phlebotomy, looking to sharpen your skills, or preparing for your NHA certification, this is the perfect place to start. In this video, we'll cover all the essentials of phlebotomy, including best practices, practical techniques, and exam tips to ensure you're fully prepared. After each chapter, we've included a Q&A section to help solidify your understanding. For the ultimate prep experience, check the description to access the Audible version, the free exam prep guide, or the Amazon link for the book. Don't forget to like and subscribe for more exam resources and updates. Now, here's your instructor to guide you on this path to certification.
Number 1. Which of the following is a crucial step when performing phlebotomy on a geriatric patient? A. Using the same technique as for adults. B. Drawing from the most visible vein. C. Taking extra time to find a suitable vein and using a smaller needle. Or D. Applying extra pressure during venipuncture to ensure blood flow. The answer is C. Taking extra time to find a suitable vein and using a smaller needle. Number 2. Which tube should be drawn first when following the order of draw? A. EDTA tube. B. Sodium citrate tube. C. Serum separator tube. Or D. heparin tube. The answer is B. Sodium citrate tube. Number 3. Which population requires special consideration and a gentle approach during blood collection to prevent any psychological trauma? A. Teenagers. B. Geriatric patients. C. Infants and children. Or D. Pregnant women. The answer is C. Infants and children. Number 4. In which circumstance should a phlebotomist consider using a butterfly needle? A. When the patient has strong and visible veins. B. When a larger volume of blood is required. C. When the patient has fragile or smaller veins. Or D. When performing a routine venipuncture. The answer is C. When the patient has fragile or smaller veins. Number 5. What special consideration should be given when performing a heel stick on a newborn? A. Applying more pressure to ensure sufficient blood collection. B. Warming the heel prior to the procedure to enhance blood flow. C. Using a regular-sized lancet for the procedure. Or D. Performing the stick at any part of the heel. The answer is B. Warming the heel prior to the procedure to enhance blood flow. Number 6. What is the maximum recommended depth for a heel stick on a newborn? A. 1.0 millimeters. B. 2.0 millimeters. C. 3.0 millimeters. Or D. 4.0 millimeters. The answer is B. 2.0 millimeters. Number 7. Which tube is commonly used for hematology tests? A. Red top. B. Lavender top. C. Green top. Or D. Gray top. The answer is B. Lavender top. Number 8. What is the crucial factor in choosing the venipuncture site? A. Patient preference. B. Vein visibility. C. Practitioner's hand dominance. Or D. Proximity to the patient. The answer is B. Vein visibility. Number 9. Which department primarily uses arterial blood gases, ABGs? A. Hematology. B. Chemistry. C. Blood bank. D. Respiratory therapy. The answer is D. Respiratory therapy. Number 10. What is the purpose of inverting tubes after venipuncture? A. To prevent clotting. B. To mix the blood with the anticoagulant. C. To seal the tube. Or D. To prevent hemolysis. The answer is B. To mix the blood with the anticoagulant. Number 11. When should the tourniquet be released during a venipuncture? A. Before needle insertion. B. After filling the first tube. C. Before needle removal, or D. After needle removal? The answer is C. Before needle removal. Number 12. Which vein is commonly used for venipuncture? A. Basilic vein. B. Cephalic vein. D. Median cubital vein. Or D. Brachial vein? The answer is C. Median cubital vein. Number 13. What should be done if a hematoma starts forming during venipuncture? A. Continue drawing blood. B. Tighten the tourniquet. C. Remove the needle and apply pressure. Or D. Change the needle position. The answer is C. Remove the needle and apply pressure. Number 14. Which of the following is an essential part of the post-venipuncture care? A. Applying a bandage without applying pressure. B. Ensuring the site is bleeding before applying a bandage. C. Applying pressure to the site until bleeding stops. Or D. Immediately removing the tourniquet and leaving the site open. The answer is C. Applying pressure to the site until bleeding stops. Number 15. What is a common reason for blood specimen rejection? A. The specimen volume is too high. B. The specimen was not mixed well. C. The specimen is hemolyzed. Or D. The specimen tube is too big. The answer is C. The specimen is hemolyzed. Number 16. Which test requires the blood specimen to be chilled immediately after collection? A. CBC. B. PT/INR. C. ABGs. Or D. Ammonia? The answer is D. Ammonia. Number 17. Which information should be included on a blood specimen label? A. Patient's name and date of birth. B. Patient's medical history. C. Phlebotomist's full name. Or D. Name of all tests ordered. The answer is A. Patient's full name and date of birth. Number 18. What is the main risk of not properly identifying a patient before venipuncture? A. Hemolysis. B. Patient discomfort. C. Specimen contamination. D. Specimen misidentification. The answer is D. Specimen misidentification. Number 19. What is the recommended angle of needle insertion during venipuncture? A. 15 to 30 degrees. B. 30 to 45 degrees. C. 45 to 60 degrees. Or D. 60 to 75 degrees. The answer is A. 15 to 30 degrees. Number 20. What steps should be taken if a patient appears to be about to faint during venipuncture? A. Continue the procedure quickly. B. Lay the patient down or have them put their head between their knees. C. Reassure the patient and proceed. Or D. Remove the tourniquet and needle immediately. The answer is B. Lay the patient down or have them put their head between their knees. Number 21. Which guideline is crucial for maintaining specimen integrity? A. Using any available tube. B. Storing all specimens at room temperature. C. Following the correct order of draw. Or D. Shaking the tubes vigorously for mixing. The answer is C. Following the correct order of draw. Number 22. What should a phlebotomist do in case of a needle stick injury? A. Wash the area with soap and water, then report the incident. B. Continue working and report the incident later. C. Apply a bandage and continue drawing blood. Or D. Wash the area with water only and report the incident. The answer is A. Wash the area with soap and water, then report the incident. Number 23. What does the gauge of a needle indicate? A. Length of the needle. B. Sharpness of the needle. C. Thickness of the needle. Or D. Material of the needle. The answer is C. Thickness of the needle. Number 24. What is a primary consideration when choosing a venipuncture site for a pediatric patient? A. Size of the vein. B. Visibility of the vein, C. Proximity to the skin surface, or D. Distance from the heart? The answer is A. Size of the vein. Number 25. Which of the following antiseptics should not be used in blood culture collection? A. Povidone iodine, B. Chlorhexidine, C. Alcohol, or D. Hydrogen peroxide? The answer is D. Hydrogen peroxide. Number 26. Which of the following is the best practice for preventing specimen contamination? A. Cleaning the venipuncture site thoroughly. B. Using new gloves for each patient. C. Discarding the first tube drawn. Or D. Using sterile tubes for all collections? The answer is A. Cleaning the venipuncture site thoroughly. Number 27. What is the appropriate course of action if a patient refuses a blood draw? A. Persuade the patient forcefully to cooperate. B. Proceed with the draw, emphasizing it's for their benefit. C. Informing the patients of the implications and notify the healthcare provider. D. Insist that it is a mandatory procedure. The answer is C. Inform the patient of the implications and notify the healthcare provider. Number 28. Which is the best vein selection for venipuncture in an obese patient? A. Cephalic vein, B. Basilic vein, C. Median cubital vein, or D. Dorsal metacarpal veins? The answer is A. Cephalic vein. Number 29. Which of the following tubes is used for coagulation testing? A. Blue top, B. Red top, C. Green top, or D. Yellow top? The answer is A. Blue top. Number 30. What is the proper order of draw in a capillary collection? A. EDTA tubes, other additive tubes, serum tubes. B. Serum tubes, EDTA tubes, other additive tubes. C. Other additive tubes, serum tubes, EDTA tubes, or D. Serum tubes, other additive tubes, EDTA tubes? The answer is A. EDTA tubes, other additive tubes, serum tubes. Number 31. What is a crucial factor for blood culture collection? A. Collecting a large volume. B. The site selection. C. The timing of collection. D. The tightness of the tourniquet? The answer is B. Site selection. Number 32. Which type of specimens needs to be protected from light? A. Glucose, B. Bilirubin, C. Potassium, D. Sodium? The answer is B. Bilirubin. Number 33. How long should the tourniquet be left on the arm during venipuncture? A. Less than a minute, B. 2 minutes, C. 3 to 4 minutes, D. 5 minutes? The answer is A. Less than a minute. Number 34. What should be the phlebotomist's first response to a patient who starts to bleed excessively after needle removal? A. Calling for help, B. Applying pressure to the venipuncture site, C. Elevating the patient's arm, D. Administering first aid? The answer is B. Applying pressure to the venipuncture site. Number 35. Which blood collection tube should be filled last when using a syringe for blood collection? A. Serum separator tube, B. Heparin tube, C. EDTA tube, or D. Coagulation tube? The answer is D. Coagulation tube. Number 36. Which organization provides certification for phlebotomists? A. FDA, B. NHA, National Health Career Association, C. AMA, D. WHO? The answer is B. NHA, National Health Career Association. Number 37. Which is the most important personal protective equipment, PPE, for a phlebotomist to wear during a blood draw? A. Goggles, B. Mask, C. gloves, D, gown? The answer is C, gloves. Number 38. What should be done when collecting a blood specimen from a patient receiving intravenous IV therapy? A. Draw from the arm without the IV. B. Draw from below the IV site. C. Stop the IV temporarily and draw above the IV site. Or D. Draw from any accessible vein regardless of the IV site. The answer is A. Draw from the arm without the IV. Number 39. What is the role of an anticoagulant in a blood collection tube? A. To promote clotting. B. To prevent clotting. C. To enhance the separation of blood components. Or D. To preserve the cells. The answer is B. To prevent clotting. Number 40. How should a blood smear for a peripheral blood smear be prepared? A. By allowing the blood to drop freely on a slide. B. By spreading blood between two slides using a spreader slide at an angle. C. By using a mechanical spreader. D. By placing the blood on the slide and heating it gently. The answer is B. By spreading blood between two slides using a spreader slide at an angle. Number 41. What is the recommended site for capillary puncture in adults and children? A. Tip of the finger. B. Earlobe. C. Heel. D. Ring finger. The answer is A. Tip of the finger. Number 42. Which of the following may lead to hemolysis of a blood specimen? A. Vigorously shaking the blood tube. B. Selecting the appropriate needle gauge. C. Properly mixing the anticoagulant. D. Following the correct order of draw. The answer is A. Vigorously shaking the blood tube. Number 43. What is the most common complication of phlebotomy? A. Infection. B. Hematoma. C. Vasovagal syncope. D. Allergic reaction to the antiseptic. The answer is B. Hematoma. Number 44. Which of the following tubes should be used for blood glucose testing? A. Gray top. B. Green top. C. Red top. D. Blue top. The answer is A. Gray top. Number 45. What is the recommended depth for a finger stick in adults? A. 1.0 millimeters. B. 2.0 millimeters. C. 3.0 millimeters. D. 4.0 millimeters. The answer is B. 2.0 millimeters. Number 46. Which of the following is the best practice for labeling specimen tubes? A. Before collecting the specimen. B. After leaving the patient's room. C. Immediately after collecting the specimen in the presence of the patient. Or D. Anytime, as long as it's before delivering to the laboratory. The answer is C. Immediately after collecting the specimen in the presence of the patient. Number 47. Which of the following procedures is used to obtain a blood specimen from an infant? A. Venipuncture. B. Finger stick. C. Heel stick. D. Arterial puncture. The answer is C. Heel stick. Number 48. Which agency establishes guidelines for specimen handling and processing? A. FDA. B. OSHA. C. CDC. Or D. NHA. The answer is B. OSHA. Number 49. Which department would typically process a CBC test? A. Chemistry. B. Hematology. C. Microbiology. Or D. Coagulation. The answer is B. Hematology. Number 50. What component is separated from the blood in a serum separator tube? A. Plasma. B. Red blood cells. C. Platelets. Or D. White blood cells. The answer is B. Red blood cells. Number 51. Which part of the arm is the tourniquet typically placed during venipuncture? A. Wrist, B. Forearm, C. Upper arm, or D. Bicep? The answer is C. Upper arm. Number 52. What is the minimum number of times a tube containing an anticoagulant should be inverted? A. 3 to 4 times, B. 5 to 6 times, C. 7 to 8 times, or D. 8 to 10 times? The answer is B. 5 to 6 times. Number 53. What is the main purpose of the Clinical and Laboratory Standards Institute? A. Regulating laboratories. B. Establishing best practices and standards. C. Licensing phlebotomists. Or D. Handling patient complaints. The answer is B. Establishing best practices and standards. Number 54. Which color tube typically contains sodium heparin? A. Red, B. Green, C. Blue, or D. Yellow? The answer is B. Green. Number 55. How should a phlebotomist clean the venipuncture sites for a routine blood draw? A. Using a back and forth motion. B. In a circular motion, moving outward from the center. C. In a circular motion, moving inward to the center. D. Randomly cleaning the area. The answer is B. In a circular motion, moving outward from the center. Number 56. Which antiseptic is commonly used for routine venipunctures? A. Iodine, B. Chlorhexidine, C. Hydrogen peroxide, or D. Isopropyl alcohol? The answer is D. Isopropyl alcohol. Number 57. What type of consent is assumed if a patient extends their arm for a blood draw? A. Written consent, B. Implied consent, C. Verbal consent, or D. Informed consent? The answer is B. Implied consent. Number 58. Which finger is most commonly used for a fingerstick blood collection? A. Index finger, B. Middle finger, C. Ring finger, D. Thumb? The answer is B. Middle finger. Number 59. Which of the following should be avoided when choosing a venipuncture site? A. Veins that are visible, B. Veins that are straight, C. Veins that are palpable, or D. Veins near a bruised area? The answer is D. Veins near a bruised area. Number 60. Which of the following is a complication of repeated venipuncture in the same vein? A. Phlebitis, B. Hemolysis, C. Hematoma, or D. Sclerosis? The answer is D. Sclerosis. Number 61. How long should pressure be applied to the venipuncture site after needle removal to prevent hematoma formation? A. 30 seconds, B. 1 to 2 minutes, C. 2 to 3 minutes, or D. Until bleeding stops? The answer is D. Until bleeding stops. Number 62. What is the proper order of draw for evacuated tubes in a multi-draw? A. Blood culture, coagulation, serum, additive tubes. B. Serum, coagulation, blood culture, additive tubes. C. Coagulation, blood culture, serum, additive tubes, or D. Additive tubes, serum, blood culture, coagulation? The answer is A. Blood culture, coagulation, serum, additive tubes. Number 63. What is the role of EDTA in blood collection tubes? A. Promote clotting, B. Preserve glucose, C. Bind calcium to prevent clotting, or D. Support cellular function? The answer is C. Bind calcium to prevent clotting. Number 64. Which of the following procedures might be performed by a phlebotomist? A. Starting an IV line. B. Administering medication. C. Blood culture collection. D. Inserting a catheter. The answer is C. Blood culture collection. Number 65. Which of the following actions violates patient confidentiality? A. Discussing a patient's results in an elevator. B. Verifying patient identity before a draw. C. Labeling tubes at the patient's bedside. Or D. Transporting specimens with a secured lid. The answer is A. Discussing a patient's results in an elevator. Number 66. What information must be included on a specimen label? A. Date and time of collection, patient's full name, and ID number. B. Patient's age, gender, and diagnosis. C. Phlebotomist's initials, hospital name, and room number. Or D. Blood volume, collection site, and physician's name. The answer is A. Date and time of collection, patient's full name, and ID number. Number 67. Which action could prevent the formation of microclots in an anticoagulated blood specimen? A. Storing the specimen at room temperature. B. Inverting the tube gently several times. C. Centrifuging the specimen immediately. Or D. Using a larger bore needle. The answer is B. Inverting the tube gently several times. Number 68. What factor could lead to a falsely elevated glucose result? A. Prolonged tourniquet application. B. Drawing the specimen after a meal. C. Fasting for too long. D. Using an antiglycolic agent. The answer is A. Prolonged tourniquet application. Number 69. When should the phlebotomist label the blood tubes? A. Before entering the patient's room. B. Anytime before delivering to the lab. C. Immediately after collection while still with the patient. D. After all the patients have been drawn. The answer is C. Immediately after collection while still with the patient. Number 70. How should the phlebotomist position the bevel of the needle prior to venipuncture? A. Facing downward. B. Facing sideways. C. Facing upward. D. It does not matter. The answer is C. Facing upward. Number 71. Which department in the laboratory would process a PT/INR test? A. Hematology. B. Chemistry. C. Coagulation. Or D. Serology. The answer is C. Coagulation. Number 72. Which of the following is the most critical error a phlebotomist can make? A. Mislabeling a specimen. B. Failing to invert tubes. C. Causing a hematoma. D. Not fasting the patient. The answer is A. Mislabeling a specimen. Number 73. Which blood tube should first be drawn when using a butterfly needle and syringe? A. EDTA tube. B. Sodium citrate tube. C. Serum separator tube. Or D. Heparin tube. The answer is B. Sodium citrate tube. Number 74. What is the appropriate angle for needle insertion during venipuncture? A. 15 to 30 degrees. B. 30 to 45 degrees. C. 45 to 60 degrees. Or D. 60 to 75 degrees. The answer is A. 15 to 30 degrees. Number 75. Which of the following would be used to collect a blood specimen by dermal puncture? A. Lancet. B. Hypodermic needle. C. Butterfly needle. Or D. Evacuated tube. The answer is A. Lancet. Number 76. How should a phlebotomist prepare a site for blood culture collection? A. Clean with soap and water. B. Clean with isopropyl alcohol only. C. Clean with isopropyl alcohol followed by iodine. Or D. Clean with hydrogen peroxide. The answer is C. Clean with isopropyl alcohol, followed by iodine. Number 77. What is the most common cause of blood culture contamination? A. Improper skin antisepsis. B. Use of expired tubes. C. Prolonged tourniquet application. Or D. Incorrect order of draw. The answer is A. Improper skin antisepsis. Number 78. Which of the following is a common symptom of a patient experiencing a vasovagal reaction during venipuncture? A. Hyperventilation. B. Fainting. C. Nausea. D. Fever. The answer is B. Fainting. Number 79. Which tube should be drawn immediately following blood culture tubes in the order of draw? A. EDTA tube. B. Coagulation tube. C. Serum separator tube. Or D. heparin tube. The answer is B. Coagulation tube. Number 80. What is the primary role of a tourniquet in venipuncture? A. To prevent infection. B. To enhance visibility and palpability of veins. C. To minimize pain. D. To prevent backflow of blood. The answer is B. To enhance visibility and palpability of veins. Number 81. In which of the following patients might a phlebotomist encounter smaller and more fragile veins? A. Adolescents. B. Athletes. C. Elderly patients. Or D. Middle-aged patients. The answer is C. Elderly patients. Number 82. What precautions should be taken when performing a venipuncture on a patient undergoing chemotherapy? A. Using a smaller needle. B. Applying prolonged pressure after the draw. C. Avoiding areas near medical devices. Or D. Asking the patient to hold their breath. The answer is B. Applying prolonged pressure after the draw. Number 83. What is the primary function of red blood cells? A. Fighting infection. B. Blood clotting. C. Oxygen transport. D. Regulate pH. The answer is C. Oxygen transport. Number 84. Which of the following conditions could lead to a rejected blood specimen? A. Incomplete filling of the tube. B. Hemolysis. C. Incorrect labeling. D. All of the above. The answer is D. All of the above. Number 85. What is the importance of patient identification in phlebotomy? A. It is a CLSI guideline. B. It prevents specimen misidentification. C. It helps in managing the workflow. D. It is a formality and not crucial. The answer is B. It prevents specimen misidentification. Number 86. What factor can influence the selection of a venipuncture site? A. Patient comfort. B. Visibility of veins. C. Presence of any complications like hematoma. Or D. All of the above. The answer is D. All of the above. Number 87. What information is essential to communicate when handing over a specimen for further processing or testing? A. The difficulty level of the draw. B. The patient's mood and cooperation. C. Any unusual conditions or complications during the draw. Or D. Your personal opinion on the validity of the test. The answer is C. Any unusual conditions or complications during the draw. Number 88. What is the significance of the order of draw in phlebotomy? A. It's based on the color of the tubes. B. It helps in preventing cross-contamination of additives between tubes. C. It makes the process easier for the phlebotomist. D. It's not significant. Tubes can be drawn in any order. The answer is B. It helps in preventing cross-contamination of additives between tubes. Number 89. How should a phlebotomist act if a patient refuses a blood draw? A. Insist and proceed with the draw. B. Inform the patient about the risks of not having the test. C. Leave and inform the healthcare provider. D. Convince the patient that refusal is not an option. The answer is C. Leave and inform the healthcare provider. Number 90. Which vein is generally the first choice for venipuncture? A. Cephalic vein. B. Basilic vein. C. Median cubital vein. Or D. Dorsal metacarpal veins. The answer is C. Median cubital vein. Number 91. For which type of testing is chain of custody most critical? A. Glucose testing. B. Drug testing. C. Complete blood count, CBC. Or D. Lipid panel. The answer is B. Drug testing. Number 92. Which of the following is a crucial step to prevent contamination in a blood culture draw? A. Fastening the tourniquet very tightly. B. Proper skin antisepsis at the venipuncture site. C. Using a smaller bore needle. D. Drawing a larger volume of blood. The answer is B. Proper skin antisepsis at the venipuncture site. Number 93. What should be avoided when choosing a site for venipuncture? A. Arm on the side of a mastectomy. B. Arm with an IV line. C. Arm with visible and palpable veins. D. Both A and B. The answer is D. Both A and B. Arm on the side of a mastectomy. Arm with an IV line. 94. What should a phlebotomist do if the patient's vein collapses during a blood draw? A. Continue drawing until enough blood sample is collected. B. Try another vein using the same needle. C. Remove the needle, apply pressure, and choose another site. D. Try to correct the needle position to reopen the vein. The answer is C. Remove the needle, apply pressure, and choose another site. Number 95. Which sample requires protection from light? A. Potassium. B. Glucose. C. Bilirubin. D. Calcium. The answer is C. Bilirubin. 96. How can a phlebotomist avoid reflux during blood collection? A. By not overfilling the tubes. B. By ensuring the tubes are filled in correct order of draw. C. By keeping the patient's arm above heart level. And D. By keeping the collection tubes below the venipuncture site. The answer is D. By keeping the collection tubes below the venipuncture site. 97. What is the proper technique for mixing tubes containing additives? A. Shaking vigorously. B. Gentle inversion 5 to 10 times. C. Rolling between the palms. Or D. Stirring with a stirrer. The answer is B. Gentle inversion 5 to 10 times. 98. What type of consent is necessary for a blood transfusion? A. Implied consent. B. Verbal consent. C. Written informed consent. Or D. General consent. The answer is C. Written formal consent. 99. Which of the following veins is most susceptible to injury from venipuncture? A. Cephalic vein. B. Basilic vein. C. Median cubital vein. Or D. Brachial vein. The answer is B. Basilic vein. Number 100. In which case is the use of a winged infusion set, a butterfly, most appropriate? A. When a larger volume of blood is needed. B. For venipuncture in small or fragile veins. C. When using a syringe is more convenient. Or D. For routine venipuncture in adults. The answer is B. For venipuncture in small or fragile veins. Number 101. What action should a phlebotomist take in case of a needle stick injury? A. Wash the site with soap and water and report the incident. B. Apply an antiseptic and a bandage and continue working. C. Ignore it if there's no bleeding or apparent injury. D. Wash with alcohol and cover the site. The answer is A. Wash the site with soap and water and report the incident. Number 102. Which tube is used for a complete blood count, a CBC? A. Red top tube. B. Lavender top tube. C. Green top tube. Or D. Gray top tube. The answer is B. Lavender top tube. Number 103. What is the best course of action when a patient appears anxious or fearful before a venipuncture? A. Proceed quickly to get it over with. B. Explain the procedure and address any concerns or questions. C. Ask a more experienced phlebotomist to perform the draw. Or D. Tell the patient that there's nothing to worry about. The answer is B. Explain the procedure and address any concerns or questions. Number 104. Which of the following is essential for accurate point-of-care glucose testing? A. The patient should be in a fasting state. B. The site should be cleaned with alcohol and allowed to air dry. C. Blood should be taken from a heel stick. D. The first drop of blood should be wiped away and the second drop used for testing. The answer is D. The first drop of blood should be wiped away and the second drop used for testing. Number 105. When is it appropriate to use the evacuated tube method for venipuncture? A. When veins are prominent and durable. B. Only in hospital settings. C. Only for pediatric patients. D. For capillary blood collections. The answer is A. When veins are prominent and durable. Number 106. What is the ideal depth for a heel stick on an infant? A. 0.85 to 1.0 millimeters. B. 1.0 to 2.0 millimeters. C. 2.0 to 3.0 millimeters. Or D. 3.0 to 4.0 millimeters. The answer is B. 1.0 to 2.0 millimeters. Number 107. Which of the following is true regarding handling and transportation of blood specimens? A. Specimens can be transported at any temperature. B. Specimens should be transported as soon as possible after collection. C. Proper labeling is not necessary if transporting within the same facility. D. It's permissible to transport uncovered specimens as long as handled carefully. The answer is B. Specimens should be transported as soon as possible after collection. Number 108. Which of the following additives acts as an anticoagulant by preventing the formation of thrombin? A. Heparin. B. EDTA. C. Citrate. D. Oxalate. The answer is A. Heparin. Number 109. Which factor might lead to a misdiagnosis or improper patient care? A. Collecting an extra tube for possible additional tests. B. Ensuring the sample is well mixed after collection. C. Drawing the sample too early or too late in relation to medical administration. Or D. Verifying patient identity using two identifiers. The answer is C. Drawing the sample too early or too late in relation to medical administration. Number 110. For which test must the phlebotomist strictly maintain the specimen at 37 degrees Celsius after collection? A. Cold agglutinins. B. ABGs. C. Lactic acid. D. Ammonia. The answer is A. Cold agglutinins. Number 111. How should a phlebotomist handle a lipemic serum sample? A. Centrifuge the sample longer to clear the lipids. B. Reject the sample and request a redraw. C. Process as usual because lipemia doesn't affect test results. Or D. Notify the laboratory for specific handling and processing instructions. The answer is D. Notify the laboratory for specific handling and processing instructions. Number 112. How can a phlebotomist minimize the risk of reflux when collecting blood? A. Fill the tubes to the maximum volume. B. Ensure the tubes are filled in the correct order. C. Hold the tubes at a downward angle during filling. And D. Minimize changing of tubes on the needle holder. The answer is C. Hold the tubes at a downward angle during filling. Number 113. What personal protective equipment, PPE, should a phlebotomist wear during routine venipuncture? A. Gloves only. B. Gloves and gown. C. Gloves, gown, and mask. Or D. Gloves and mask. The answer is A. Gloves only. Number 114. What is an important consideration when performing venipuncture on a geriatric patient? A. Veins may be more fragile and prone to injury. B. Only larger veins should be selected for puncture. C. The process should be quicker compared to younger patients. And D. Tourniquet application is not necessary for geriatric patients. The answer is A. Veins may be more fragile and prone to injury. Number 115. Which of the following tubes should be used to collect a plasma specimen? A. Red top tube. B. Serum separator tube. C. Lavender top tube. Or D. Green top tube. The answer is D. Green top tube. Number 116. Which tube should be drawn last when collecting a CBC, PT/INR, and electrolyte panel? A. Lavender top tube, CBC. B. Blue top tube, PT/INR. C. Green top tube, electrolyte panel. Or D. Red top tube. The answer is C. A green top tube, electrolyte panel. Number 117. Which of the following is essential to ensure the quality and integrity of blood specimen? A. Collecting a slightly larger volume to account for any testing errors. B. Using a tourniquet to make the veins more visible and accessible. C. Properly identifying the patient before specimen collection. And D. Allowing the alcohol to air dry completely before venipuncture. The answer is C. Properly identifying the patient before specimen collection. Number 118. How should blood be collected from an infant's heel? A. Using a standard lancet, puncture the center of the heel. B. Using a safety lancet, puncture the medial or lateral aspect of the plantar surface. C. Using a regular needle, carefully puncture the heel. Or D. Using a butterfly needle, access the superficial veins of the heel. The answer is B. Using a safety lancet, puncture the medial or lateral aspect of the plantar surface. 119. How should a phlebotomist approach an uncooperative pediatric patient for blood collection? A. Process quickly, using force if necessary to complete the draw. B. Communicate clearly, engage the patient, and use comforting techniques. C. Ask the patients to leave the room to reduce the child's anxiety. Or D. Tell the child that the procedure will be extremely painful. The answer is B. Communicate clearly, engage the child, using comforting techniques. Number 120. In what situation would it be necessary to perform a blood draw without wearing gloves? A. When the patient has a latex allergy. B. When performing a capillary puncture. C. When gloves are not available. D. It's never appropriate. Gloves should always be worn. The answer is D. Gloves should always be worn.